spinal muscular atrophy is a relatively common of the rare diseases, and it's manifest with weakness. Kids are smart, they're intelligent, they're well coordinated. All those wonderful other neurologic functions are unimpaired, but they're weak, and they range from babies that are so weak they can't breathe, the so-called old Wernicke-Hoffmann, they would die in the first year or two of life, to adults who just can't bound up the stairs as fast as they want to, and every gradation in between. This study is taking advantage of a known internal hormone that isn't real well publicized because we haven't been able to manipulate it. It's myostatin, which is the hormone that muscles use to regulate how much muscle mass they're going to have in response to exercise. Pharma has been trying to figure out a way to manipulate this for the last decade and have largely failed for a bunch of complicated reasons. But this is the first approach that has shown a benefit. And one of the ways they did so was by studying kids with this rare but very well-defined disease where we have outcome measures. And if I could make every child with SMA 20% stronger, it would be meaningful to their lives because they're profoundly weak. And if you're very weak and you can do this much more, it will make a difference in your life. So we have a disease in which a small difference is meaningful and measurable, and the intervention, the ability to inhibit the myostatin levels, which is the way you can increase muscle mass, was done by a completely novel approach that had not previously been tried. Many people probably know about SMA because it's had this incredible response. Babies with SMA in the past, when they were diagnosed at birth, were going to die. And now that we have three different therapies for the SMA itself, we can basically reverse it. It's like reversing polio. It's that dramatic. Babies, some of them don't even know they have the disease if we diagnose them at birth by the newborn screening program. On the other hand, quite a few are improved, but not that much. And certainly, if you've started it after disease has progressed, children have persistent weakness. It's those kids that have persistent weakness or the disease modifying therapy Spinraza and Zolgensma and Evrysdi was inadequate, that we studied and showed that this addition of a drug that's not targeted at the motor neuron but at the muscle adds benefit to them. And so it was in that very, very rarefied group that we were able to show the benefit effectively with a small group. So the outcomes we used were some established measures that are really focused on SMA. There's a Hammersmith score. It's basically an ordinal scale. Can you roll over? Can you pick up your head? Can you lift your heads? Can you feed yourself? A series of stage things that if you can do this, then you can do this. If you can do this, you can do this. Blah, 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 blah. And so with that, we can get a nice scale score of where you are with it. And it was with the Hammersmith outcomes, we were able to show a difference between the patients who were given the drug, the apitegromab, versus the placebo.